Hey, we're back again in our continuing series of understanding cancer. Today, let's talk about risk factors for cancers. Okay, did you know that more than 70% of cancer risk factors is actually something we can control? Okay, there are a few other risk factors that are beyond our control, like genetic risk factor or family history, or a few other things that, certain syndromes that put you in a high risk. But more than 70% of cancer risk is actually something within our control, meaning it's our lifestyle, is how we live our life, it's the choices we make. Okay, so let's break them down. One is tobacco and cigarette smoking, shisha as well, put it in there. Okay, vaping, all these will really mess up your health. Cigarette smoking is actually, or tobacco smoking, or tobacco products are actually associated with more than 10 cancers. Cancer of the tongue, of the mouth, breast cancer, colon cancer. All these are actually associated with smoking. Number three is not maintaining a healthy weight or a little higher BMI. There's enough data that obesity or overweight actually can expose you to certain cancers due to persistent background inflammation that is associated with obesity. Okay. Number three is alcohol. Alcohol does not only affect the liver, guys. There's so many cancers associated with alcohol, including the colon cancer, including and even head and neck cancers and all that. So the earlier you quit today, the better. Okay. The other one is infections, especially in our neck of the woods in Africa. There are certain cancers actually that are highly associated with certain infections. For example, human papillomavirus for cervical cancer. Again, hepatitis B and C, liver cancer. The HIV infection can actually predispose you to certain cancers. So getting vaccinated actually will really cut that process and also will really boost your immune system. Okay. The other one is genetics. It's actually only 5 to 10% that yes, cancer runs in the families, but it's actually your lifestyle that has a higher risk factor for cancers than your genetic makeup. Okay, there are few cancers such as the ones in the breast or ovarian cancer, that are a bit related to genetics, specifically if you have a high and a strong family history, but it's just 5 to 10%. Again, as I said,